Kim Lynch and Spring Lane.
I'm Kim Lynch, CEO and founder of Metis Health Technologies. With over 20 years in health tech, I've dedicated my career to leveraging data and technology to enhance patient care, empower clinicians, and advance the quintuple aim in healthcare. At Metis, we push the boundaries towards a fairer healthcare system symbolized by our emblem, a bee, inspired by Marcus Aurelius. What injures the hive injures the bee. One of my earliest memories, happily twirling in a chair at my pediatrician's office, sparked my passion for ensuring everyone has access to care that treats them as individuals. At Metis, we're on a mission to enable this kind of care in every community. Today, healthcare is out of balance, primary care is under threat, and many healthcare businesses are unaware of key aspects of their operations, worsening workforce burnout and hindering engagement and satisfaction.
Hi, friends. I am Spring Lane, the steward of exceptional wellness. At EW, we are reshaping healthcare, the whole industry, through our direct care network. Our mission is magical, and not only because of our collection of dabbing unicorns and rainbows, but because we educate, equip, and empower people to be exceptionally well. We tell people every day how awesome they are until they believe it, fulfilling our purpose to love folks exceptionally. Together, we invite you to join our journey as we discuss innovative ways to revolutionize healthcare, whether it's breaking down complex topics, sharing success stories, our tiny joys, or exploring new methodologies. We're here to make sense of it all. Share your thoughts, topic suggestions, or success stories at beesandunicorns.com. We cannot wait to hear from you.
I'm joining you today from what is actually the rather balmy and humid shores of the Atlantic up here in Maine. I'm on Georgetown Island today. It's really lovely. I'll show you quickly. We've been coming up here for nearly a decade. That's Sagadahoc Bay. It's pretty spectacular. How are you doing this morning?
That looks like, what's that movie with the best friends with Bette Midler?
Beaches? I love that movie. I haven't thought about that movie in a long time. Indeed, ma'am. Indeed. How are you doing today?
I'm amazing. I just got back from a great trip in Utah, getting to see the sunrise over the mountains. Oh my gosh, so beautiful. Doing sunrise hikes every day. I was like, I could get used to this for sure.
I love that. That is one of my favorite things about being an East Coast person who gets to travel occasionally to the West Coast, especially for work, because you can totally knock out a sunrise hike in Utah, Colorado, any of those Western states, and then like show up for like a productive day. And it's amazing.
Yes.
Well, let's get into it. I want to hear your tiny joy, my friend. What's going on with you?
I feel like I have so many. The one I'm going to pick for today is my oldest grandson. Yes, I have grandkids. If you've listened to us, you know this. I have 7 of them. And my oldest is about to turn 5. So 7 grandkids.
Such a big birthday.
Under the age of 5. And he loves like silly things. When we will watch, we'll go through Amazon and, you know, like sometimes if something doesn't pop up, it'll show a little dog. And he's like, and I'll click it again just because it'll put up a different dog. He's like, another dog. And so anyways, I got him a googly-eyed unicorn pen because why not?
Because why not? It's amazing. Oh my gosh. That's hilarious. Your grandson and my youngest sound like they could hang out because my youngest is obsessed with dogs. Up here in Maine, we were at the grocery store and they have, I'm not going to remember the exact title of it, but like a Maine dog newspaper. And I was like, yes, please. And I brought it home and like he and his brother were sitting there like rapt attention reading about the dogs of mid-coast Maine. And I was like, all right, so your grandchild and my youngest should totally talk dogs. What a fun pen too. Like I love the googly eyes.
It's your tiny joy.
Well, my tiny joy has a visual aid today as well. My eldest child picked these beautiful wildflowers for me in Maine, put them so artfully in this glass with rocks. And it is my tiny joy. It continues to be my tiny joy. It's really spectacular. So that's my tiny joy today. Maine wildflowers as prepared by a 15-year-old. I thought so. I'm a big fan. The foxgloves are really impressive around here. I mean, all the flowers here are gorgeous, but I love it. Any hoodle. What a good transition into today's topic that we're cracking into for the second time. We're talking about community. When I think about the community here in Georgetown, Maine, this island where you've got, lobstermen and, clamming and all sorts of different types of people who lived here for, let's see, it was founded in the 1700s, this island. The community could not have thrived without a doctor, could not have thrived without, I think, the doctors who lived here serving their community. And I think that's my like leaping off point of where community just keeps on coming back around to me as such a touchstone of what does good look like in our day-to-day lives, whoever we are.
Yeah, I love that. And, for me as a clinician, I talk to so many, one of the things I'm working on right now is really this curriculum to help providers who maybe are a little burnt out, maybe have said, I'm going to do something else because what they've seen in primary care has been painful, right? And we laugh about it, but like there's Dr. Glaucophin on TikTok, who the optometrist who does the really great videos about, I know, right? He does these great videos about healthcare and some of the pain points. And one of the ones recently was talking about the problem list that has become like ridiculously long with like pregnancy for the 85-year-old, because they had the same problem list for, I don't know, 4 decades. So it's like ridiculous. And they call in who? Family medicine, right? Let's get primary care in here.
Always.
They're going to clean up all of our mess. And that's kind of
to clean
how
up the
family
mess.
medicine has been treated, right? Yeah. Like, here's a problem you didn't create, but we're going to let you fix it and like basically spend your life doing administrative work and not getting paid for the real things that you're doing for your patients. Also, we're going to make it really hard for you to actually make an impact with your patients because you've got to see 15 of them in an hour so you can pay your bills. So, it's like those pain points and being able to speak to clinicians and say, hey, we are building another way. Like it's already here. It's already happening. You can create. And, it's like there on the one hand, it's like people say, I want to be like that doctor I used to know back in like the 50s and 60s, right? Who was like what you're talking about, who's in the community. And that's great. And for me as a clinician, I'm like, yes, I want that. And I want to have like a real life where I'm not an indentured servant and I don't only live to serve my patients. I love to serve my patients, but like I want to also have a life. And like, how can I leverage technology and other resources to help me do an exceptional job of taking care of my patients? Also, how do I help them be well? And so when I think about all of that, it all comes back to community. You can't do it alone. You can't do it without other humans, right? Like, yes, technology is amazing, but we need people. And I think the biggest thing that we are crying out for, and the literature supports it, we'll talk about that more in a second, but we are crying out for connection to real humans.
We are, and we see it everywhere we go. I certainly do in my own life. I see it with my kiddos. I mean, our two younger children went away to summer camp this summer, and our youngest was really nervous. It was his second time going. He was really excited. He had a great experience last year, but my ask for him, as I gave him a hug and sent him off to camp was just try something new, try new things, like be brave, try 3 new things at camp. And the confidence that he came home with of I was able to build new relationships. I was able to, be myself and in a place I was able to be brave and try some new things. Also, he did a stand-up routine as part of the talent show. I could not be prouder. Did a little set of John Mulaney jokes. It was amazing. We have a photo, no video. So his next dates are TBD. But that willingness to put yourself out there, that willingness to be a little brave, that plasticity of growth that is so evident and clear to us when children are young, I think. My observation, again, back to my experience, man, if I'm not growing, if I'm not part of growing something, then I'm stagnating. And to me, community is where I love to invest. It's what I learned as a young child. It's what I love seeing my own children grow in themselves as they build community beyond, our family. It's so necessary. Like you're saying, it's also backed up by all of the literature. So I think really the purpose of this episode is to talk a little bit more about, how to create community and how to, I guess, measure it. If I'm going to think of, how I approach this conversation, I really want to talk about like how it feels is how we measure it, period. It can be other measures as well, but, knowing that you feel like you belong, that you have a place, like that's the measure. And being brave to try new things, like that's a sign of good, healthy growth, as are just as evident to me as you drive through, agriculture fields and see thriving fields.
Yeah, I think I love the how it feels is a measurement. And it's like, well, then how do you collect that data of how it feels, right? So one of the things that we do for our clinics is we have this assessment that we call the 12 Rings to Exceptional Wellness. I know we need a shorter name. Kim's going to help us think of an acronym at some point. But anyways, it's what the literature supports in what makes someone feel alive, worthy, and liberated, right? And so a big part of that, actually 3 parts of this one assessment deal in some way with community. How do you feel connected to others? Like, are you getting hugs daily? Are you having physical contact with people? Are you investing in those who aren't where you are today? Like they're maybe a little bit behind you in their journey in life, because that's important, how we give to others. And are you in a position where you're receiving from others? So those are all important parts of community. And so I think really being intentional about asking those questions, I was talking with another family practice doc yesterday about this, because I was like, when we sit there and we ask patients, like, what do you do for fun? What do you do to show your creativity? And, all these questions, we really get into those things. I'm not a counselor, we don't have a counselor on our staff. It's not about, I think we've talked about this before, this dynamic of sometimes it's like, I don't want to ask those questions because I don't know what to do with the information. And I'm just encouraging people, just show up as a human, right? And yes, take the research, because that's what we do, right? In evidence-based practice, and say, hey, here's what research shows. And I love that you said, like, we have to like think about how do we create communities, I think is a great question. And I mean, there's a lot of different ways. So I actually did a little bit of research with my AI, I just learned about Perplexity. I was telling Kim about that earlier, but it's so great. But being able to pull together information really quickly is fun. And I just want to give you a couple of statistics.
Another like
just
behavior. I just want to interject, like this is another behavior of community, of growth, of sharing information with one another. Like this, to me, these tiny behaviors of like, did you get a hug today? Did you, talk about something you learned about today? Did you learn something for yourself today? These are all tiny, 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 tiny grains of sand on that. Like, am I growing? And am I growing myself? Am I growing with others? I think is exactly the question. So please fill us in on some of the research, Spring.
Yeah, I totally agree. So kind of like a lot of us know that we've got a lot of mental illness in the US, right? We've got about it, according to the CDC, about 20% of adults have some form of mental illness. And, not everyone goes to get these screenings. So, that's a lot, over 50 million Americans. And then we've got 15% of adults with a substance abuse disorder. And when you dig into the data, a lot of what you see like when people come out of these kinds of situations or get improvement, it is related to community. Like one of the number one factors in someone being able to stay sober, from a substance abuse disorder, or feel joy and feel well from a mental illness, is community. It's connection to other humans. And so like when we know that like 1 in 5 of our peeps are really struggling, and I think that we should be really intentional about how we address that, knowing how big of a problem it is. If we look at the financial burden, there's so much, right? And I am such a mom. I start thinking about the family. I think about the family unit, and I think about, we've got parents who have substance abuse disorders. So then their children are growing up with a numb parent or an absent parent. And There's just so many of these layers of things that affect community. And then, we've got the things where socially we're very isolated, right? We're all in our own homes. We don't really share homes. People don't really share any kind of, we used to have like Sunday dinners and different things. My grandma growing up, they had like almost nightly get-togethers where somebody's playing the spoons and somebody's playing a guitar, and they're playing music together and dancing together. And, there's research to show that dancing is like one of the best things you could do for your mental health. So you've got all of these layers of things. And to your point about sharing, right? The less we're in community with each other, that wisdom doesn't get passed on. People don't learn the things from the generation before or 2 generations before. And so it's so important, and we're losing that. So I think being super mindful of like how we structure things, and kind of to get back to the whole provider thing, I have heard this trend now from many providers. They have this same vision of like, I want to create this integrated where we're not just in buildings, right? Like we have a courtyard or an outside space where we're doing activities, physical activities, we're cooking together. They're describing community, right? They're seeing it. And they're like, we need this. Everybody is saying that same thing. I'm hearing it over and over. And I just love that trend is coming along.
Me too. I couldn't agree more. And I'm starting to have conversations with employers in particular who already understand that their workforce thriving means their businesses thrive. I'm like, great, wonderful. I don't need to convince you of that. And I'm thinking specifically of healthcare workforces, of trucking, grocery store, any job that requires your body, to totally clear to those business owners that their teams thriving equal their businesses thriving. And where I come at that as a public health person is, okay, well then how are we spending this much money and getting such crappy results? Let's look at, the problem from a systemic view. And the issue is that we're spending far too much at the bottom of the waterfall instead of in upstream prevention. We can do the waterfall metaphor all day long, but this conversation with employers and with CEOs that I'm so excited about is they're really starting to have this conversation of, I know what healthy, thriving employees look like, and I want to invest in what that can look like. And it's everything that Spring is talking about is finally starting to really be discussed. What if we brought on-site wellness and primary care? What if we had on-site physical therapy and, movement practice? What if we brought in fruits and vegetables through local, farming co-ops or CSAs? What might it look like if we, had mindfulness breaks and really encouraged everyone on the workforce to practice taking care of their mental health alongside their physical health as it's necessary for our patients or residents? Those conversations are starting to happen. And what I think is so evident, the reason I talk about people like I talk about fields, forgive me, I'm from Michigan. We do a lot of driving through cornfields and soybean fields and fields of all sorts, is that you can see when a farm is thriving. You look at it, you can see when everything is just, going gangbusters, and you can see when a farm is struggling. Same to me is true of a person pretty quickly, right? Not always. And certainly of a community. You can see when the community is thriving, you can see when it's struggling. And I think a real honest assessment of, are we getting what we want out of our lives? Are we supporting each other? What makes us happy? And having real and honest conversations about that as an individual, in our families, in our households, I guess is what I should say, and in our immediate communities, is a conversation that I think people are dying to have, are really urgently needing to have, because like you're saying, Spring, the social isolation, we can see that. We can see that in our communities. I hope. I certainly see that in my loved ones and in my communities. And those are not the people who are thriving. The folks that are doubling down on, fear or anxiety. And I understand, especially over the last few years where we have had such little social contact with one another, that restarting those behaviors is extra hard. And I think it's incredibly important for us to challenge ourselves to keep growing and to take an honest look at our communities and say, are they thriving? Are they not? If not, where are the resources going? It's a big, complex conversation, but really, if our community is not thriving, the first question that I want to ask is then where are our resources going? Because as humans, as the beautiful places that we inhabit in this, we all have value. We all have the capability of thriving. And if we're not, that is not a solo endeavor. That is not just an us problem. And I think the conversation of where are the resources going, along with unburdening the shame of it's just me, I feel like the second biggest thing we've got to talk about is it's not just me. And then where are the resources in my community going if they're not going back into reinvesting in our community so it continues to thrive?
Yes, I totally agree. And I want to give you a couple of numbers real quick because I want to talk about, you talked about your kids going to camp. And something I've been noticing a trend of is more of these like wellness retreats. And there's a whole bunch of like really funny skits on TikTok about them and Instagram. But I know from personal experience how refreshing and rejuvenating these can be because for me, it's about community. I mean, like we spend time with each other. There's so much hugging and just talking and really deep conversations. To me, it's more refreshing than any vacation ever was. And I see this trend and I think it's part of that like deep yearning for true community. And I want to talk about something I'm also seeing grow, but this is back in 2017, $639 billion was spent in wellness tourism. And in 2022, it was $919 billion. So like this is a growing industry. And like I said, I really believe it's because people are just
holy moly,
craving this. Yeah. And one of the trends that I'm seeing now, which I super love, is like, so we have a yoga studio here that they have started to invest in like a wellness weekend retreat. So it'll span over like 3 months, right? And so you have local people getting together at a local center on the weekend and spending that same kind of deep time together. And it is building community, right? And I love this thought of like, how do we bring that retreat feel to real life, right? Because to me, that's what we're supposed to be having. Like, I think that's what we were always supposed to have. And so figuring out like, yeah, maybe you have to go experience it one time. And like, we were talking about the money not being local, but like, you got to see it, right? See one, do one, teach one. So you're going to see it. So wherever you can go to see it, but like have your mind and your eyes open to like, what can it feel like? How rewarding and enriching can it be to share ideas with like-minded people and share time and space with them? And then like, okay, how can I create this here? And it's going to be different, I think, for each group of people and each community. But if we get intentional,
it should look different.
Creative ways.
Yes.
Yeah.
Yes. 100% yes. And it should look different. I'm in Maine right now, but I'm from Michigan. I live in Maryland. Apparently I have a real thing for M states, and I super love that for me. The point is, what works in Maryland doesn't work in Michigan. What works in Michigan doesn't necessarily work in Maine. And the beauty of measurement, qualitative and quantitative. And qualitative, I mean, how does it feel to me? Am I happy? Am I thriving? How are my children doing and feeling? Matters just as much as any number. In fact, I'd argue far more than most numbers, but to each their own. You get to measure how you want to. But my point is, everything you're saying possible for us if we choose to build it for ourselves. And I think there's been a huge fallacy over, I don't know, certainly my 20 years in the workforce of bigger is better, that someone already has the answer, and that I just need to go to the fancy, whoever is fancy in that area, and they will give me the answer that I need for whatever problem I have, was very much I feel like the ethos of the last 20 years, at least in healthcare and business. And what I'm realizing at this stage of my career that totally aligns with what you're saying, Spring, is that actually the problems need to be solved far more locally. We say all the time that healthcare is local. I think the problem solving needs to happen more locally as well. And then the job of those of us who happen to be in a position to share information with others, one, do it, share, help each other, The metaphor that has been coming to mind for me over and over again is like an archipelago. So, a group of islands, you're always part of this like chain of helping each other figure it out, helping each other, be creative in your community, and also sharing measurement methodologies, including how do you count that the feelings matter, and how do you measure in your community very specifically the resources in our community, how much were they reinvested in our community and how much of those resources were extracted from our community. That should be a pretty quantifiable metric.
Yeah,
I don't know how to do
I
it
think
yet.
that's great.
But my point being, they both matter. Yeah, go ahead.
Yeah. I totally agree. And I know we're getting close to time. So some actionable things, right? Like I said, I'm approaching this as a provider, thinking about like, how do I ensure that what I'm doing is actually creating a local impact, right? In the communities where our clinics are, I want all of that to be in the community. I wanted to help thriving communities grow more and more in a live, worthy, liberated way, right? So there's 6 things that we can do. One is choose partners that you can coordinate with, collaborate with in your area that are willing to be transparent. I could go on and on. We'll do a whole episode on transparency at some point because I know we've both had some experiences with not having that and with having it. And when you have people who are willing to be transparent about their financial structures and how they're allocating their resources, then you've got a good partner, right? Number 2,
there's actually, just pause on that one for a second.
Go ahead.
That one is so incredibly crucial. And when we do that episode, I don't want to forget that we should talk about Zingerman's. It's a community of businesses, but they started out as a deli in Michigan and they've become massive since. They have pioneered something they call open book management, and they train, I think, all of their staff on it as well, so that every single member of the team can understand the measures that matter to the business. And right there, transparency off the bat. I could not agree with you more. We have both worked in organizations where it exists and where it hasn't. And where it exists, my goodness, will people work hard and run up the score in those situations. And where it isn't transparent, you have people banging into each other and a whole lot of time wasted.
Exactly. And you have the accountability, right? Because one of the things that I've learned in sharing transparently is, when you share things, sometimes it's like, oh, I don't want to share that because it's kind of embarrassing. And if I'm working with a true partner, when I share that, it makes us both better. So, transparency is really important. The next thing is local decision making, or like you said, local problem solving, right? You want people who are going to be in your community. They see things in the same way. They're seeing the same trends in your area, so that they're the ones who are making the decisions about how we're going to use the resources that we've collected. One thing that I heard recently that I thought was great was anytime you get investments, don't let them have more than 15% of the company, and don't let them have a seat at the table to make decisions for the board. And I thought that was some great advice because, yeah, sure, if you want to make some dividends off of what we are doing here because you see it and you know that it's great, cool. Also, you're not going to get to make the decisions because the people who live here, breathe here, make babies here, they're the ones who are going to make the decisions. So I think that local decision making is great.
As an entrepreneur, I just want to say I've gotten the exact same advice from some of the best investors in the world. And that advice of keep your board, keep your decision making small, keep it local is true whether you are building something, truly like a front door on Main Street or something virtual or a business. Like, you having your ideas and retaining creative ownership with the people, as Spring's saying, who see and want to manifest that same vision. Like, don't get ensorcelled by what money brings to the table. Often it's just money.
Absolutely. And I feel like we're going to need to do an episode on each one of these. So I'm going to run through the rest of them real quick because I know I got to go soon. But 3 and 4 are very similar. 3 is reinvestment. So selecting partners who are committed to reinvesting resources back into your community. So like that needs to be a commitment up front. Then shared values. So like I said, similar, but also say, okay, what are we actually trying to accomplish, right? So that you're cooperating with people who are wanting to keep the community needs over any kind of corporate profits or other things. The next one I know is a hot topic for Kim and me too, but community representation, making sure the people you're impacting are at the table. You have someone.
What a crazy idea. Whoa. It's one of my favorite things every time I see another piece of research come out on shared decision making and how effective it is. I'm like, you don't say. And we spent money on that. Okie dokie. That's a weird choice. And honestly, like, this is where I have to just roast academia for a minute, because for God's sake, y'all, this is where academics and anyone who considers themselves part of the science behind the things we're talking about, you have to humble yourselves. You have to be more curious of the folks in your community who are solving problems in real ways. And let's be honest, that's not usually the stance of academia. It is, however, where the greatest innovation happens. We must figure out how to be more curious of those problem solvers and how to replicate their solutions. And those are literally the conditions ideal for the diffusion of innovation. I make this hand gesture because what you're supposed to have for ideal innovation is your horticulturists, your botanists in an agricultural context, your academics, working with your practitioners, your farmers. Together, that is what creates beautiful yields and untold leaps in innovation. We have the emerging conditions for that, I think, in healthcare. And as Spring said, that's what gives me so much hope too, is the innovation happening in communities and the fact that technology is enabling us to share with one another, learn with each other, and to then say to the folks that do hold, research dollars and all sorts of other, great purse strings, let's get innovative in some new ways. There's some well-trodden ground that we can acknowledge and roll on from. Good golly.
But that, as a practitioner, when you're thinking about, or as any business owner, or even as an employee,
Exactly.
You're saying, okay, I want to do this. These are the things you can look for: transparency, local decision-making, reinvestment, shared values, community representation, and measurable impact, so that you can be guided towards, how do I keep it local and help support my communities?
And the last thing I want to say on measurement, because we will definitely touch on all of these, is one of the best things I was ever told about measurement by a brilliant human was, even just because you can't measure it doesn't mean it doesn't matter. And that's where the aspiration of, like, how does it feel? I can't easily quantify that. I can't easily write it down. It doesn't matter. It still matters. At that ideal, we don't need to wait for perfect measurement. Far from it. I think folks get really held up on that point. So I can't wait to keep unpacking this. And this dialogue of Community Spring, it feels just so exciting to me. And I love this conversation with you every time. So can't wait to pick it up again, because community, we're not done with you yet. We're coming back around for sure.
Absolutely. Thanks, Kim. Enjoy the waves.
Thanks so much. Will do. Bye, y'all.
Thank you so much for joining us on Make It Make Sense today. I hope you enjoyed this. I hope you got something that you can take and actually use in real life. I hope that you want to share a tiny joy with us. And if you do, please go to makeitmakesense podcast.co, because we love hearing your stories.